Welcome friends. Today again we are discussing introduction to the basic in veterinary diagnostic imaging, the SWAM MOOCs course, and the title of the lecture is Basic of Magnetic Resonance Imaging. I am your course instructor Dr. Rahul Kumar Udaiya, Assistant Professor, Department of Veterinary Surgery and Radiology, Faculty of Veterinary and Animal Science, Banaras Hindu University. So let's discuss about the basics of magnetic resonance imaging or MRI. So today the topic will discuss in the following chapters, like first we will discuss about the introduction of the MRI, history of the MRI, basic principle of the MRI, various terminology which is used in the MRI, imaging hardware, various contrast agents used in MRI, safety procedures, preparation of the animal for MRI, and various type of application of MRI in veterinary patients, and finally we will conclude the today's topic. So let's start from the introduction. So first of all, the MRI means the magnetic resonance imaging. This is a imaging modality which is based on an interaction between transmitted radio frequency wave and hydrogen nuclei in body under the influence of strong magnetic field. Nowadays in our veterinary field, the MRI is getting popularity due to its high contrast imaging, especially for the soft tissue. The magnetic resonance imaging is a spectroscopic imaging technique which used in veterinary as well as in medical setting to produce image of the inside of the body. MRI is based on the principle of nuclear magnetic resonance, which is a spectroscopic technique used to obtain microscopic, chemical and physical data about molecules. So after introduction, we will discuss about a brief history of the MRI. So the MRI was discovered by Felix Bloch and Edward Purcell. Both are American scientists and both are awarded with the new Nobel Prize in the physics in 1952. So initially between 1950 to 1970, the MRI, magnetic resonance imaging, previously is known as nuclear magnetic resonance, was used mostly for analysis of chemicals and molecular. In 1976, scientists Paul Lutterberg and Sir Peter Mansfield imaged a finger of his research student Dr. Andrew Maudslay and got success. Both the scientists got Nobel Prize in 2003. In veterinary field, especially in dogs, were being snuck into human MRI facility as late as at the mid-90s. Nowadays, many veterinary research institutes is having their own MRI facilities. So MRI provides detail about the structure and function of the body part on a slice by slice in a gray scale map. While the hydrogen proton in the body are the basis of magnetic resonance imaging, because the animal body contain more than 70% of water, and major part of the water is consist hydrogen atom. This hydrogen proton is a positively charged particle, and it continue spinning about its own axis, randomly oriented within the body. So these protons also move in accordance with the motion of their host molecule. The distribution of hydrogen nuclei depends on the tissue type and whether tissue is healthy or the diseased, which affects the intensity of the image of the part of MRI slice. So magnetic resonance has a much greater affinity to soft tissue contrast as compared to the CT scan. So magnetic force which is used in the process of magnetic resonance imaging is approx 1 to 2 Tesla. It is having 30,000 times stronger than the earth magnetic field. You think about how much it is strong. The body protons are most abundant in the hydrogen atom, so that the MRI image shows difference in water content in different tissues, because every tissue should have a different water level. If you are scanning a brain, so in brain the gray and the white matter can be distinguished by this MRI imaging technique. Let's discuss in short about the principle, how the MRI work in a patient. When the patient is kept in a MRI machine, the radio waves are passed through the animal body. Then the proton nuclei of the hydrogen atom may get activated in a higher, strongest magnetic field, so that it may get excited, and simultaneously the hydrogen atom may get released. When that atom may get relaxed, or the proton may get relaxed, the radio signal may get released. That radio signals are scanned by a scanner, and this scanner send all the data toward the computer. Computer process all the data and form an image. So this is a very small size principle of the MRI. Let's discuss about in detail about the principle. So during imaging of the animal body is magnetized using a powerful magnetic field within the MRI machine. Under the strong magnetic field of the scanner, the hydrogen nuclei in the tissue align with the field. Afterward, the radio waves with the right frequency are applied over the patient, so that radio waves get interact with the protons. The protons absorb the energy of that radio wave, and some of the energized proton moves out of the alignment. Immediately the radio pulse may get stopped. Afterward, the proton then return back to the alignment, producing a rotating magnetic field as they do so. The process is called as relaxation. During this relaxation period, some radio waves are produced by the proton. The movement of the magnetic field produced detectable electrical signal in the receiver coil. Different normal tissue relax at the different rate, so that they are having different T1 and T2 values. So, the T1 and T2 values we will discuss in next slide. The normal tissues is injured or the diseased, that means the relaxation rate changes and alter the tissue MR appearance. The gradient field in the 3 dimensions allow the scanner to work only with the proton from a slice at the time. Then the image is produced and displayed on a gray scale from the black to bright white. If you want, you can use a contrast agent. That agent can be administered to patient to enhance the region of interest. So, this is all about the principle. Now, we will discuss about some important terminology which is using in MRI. So, Lobar frequency, the frequency is generated by a proton during relaxation period or during oscillation period. Free induction signal, when the radio frequency is applied over the proton, some certain radio signals are produced by the proton which can be received by a receiver. So, that is free induction signal. Spin lattice relaxation time, that is also called as T1. When the proton may get relaxed after getting radio frequency in a longitudinal mode is called as T1. It is different from water, air, fat and other type of tissue. Another is a spin relaxation time, it is called as T2, when proton is relaxed in a transverse direction, so it is called as T2 relaxation time. Another important term is FLAIR, FLAIR, fluid attenuated inversion recovery, used for water content in a body. STIR, STIR, short tau inversion recovery, it is used for fat tissue. Another word is DWI, diffusion weighted imaging, ADC, apparent diffusion coefficient, etc. So, these are the certain important terms which is used in MRI. Let us talk about the T1 and the T2. When the radio frequency pulse is stopped, higher energy gained by the proton is retransmitted and hydrogen nuclei is relaxed by two mechanisms. The T is basically stand for the time, means time of relaxation of nuclei, so that the radio frequency may get fed. So let's talk about the T1. T1 has a short repetition time and having a long time of echo. What is repetition time? The time between two excitation pulse is called as repetition time. What is time to echo? It is a time between the excitation pulse and the echo. The T1 gives a more fine anatomic details of an organ. In T1 weighted image, the water and fluid appears black with very low signal, while the grey matter in a brain appears darker than the white matter. Let's talk about the T2 or T2 weighted image. It is having a long repetition time and long time to echo. The contrast in a T2 weighted image having more contrast between pathology and the normal anatomy. In T2 weighted image, the water or fluid appears white with very high signal. In contrast to T1 weighted image, in T2, the white matter in brain appears darker than the grey matter. So this is a difference between T1 and T2. Now these are the certain tissue and the signal intensity for T1 and the signal intensity of T2. So this chart is showing the fat which is having a very high signal intensity in T1 and appear as a white, while in T2 it is having a intermediate signal intensity. Muscle, it is having intermediate in T1 as well as intermediate in T2, and it appears grey in T1. Hyaline cartilage, again it is intermediate in both the image. Ligament tendon, again it is low for both the image T1 and the T2. For cortical bone, again it is low for both the images T1 and the T2. Granulation tissue, that means the T1 having intermediate signal intensity while the T2 is having very high signal intensity. Fibrous tissue having low in both the T1 and T2 images. Hemorrhage and the edema having high to intermediate and high to whitish in both the signal intensity T1 and the T2. Immature scar having intermediate to low in T1 and T2, while mature having low to low signal intensity. So this chart is showing a various intensity for both T1 and T2 for various type of tissue. So now next, this image or this chart is showing the grayishness of various tissue in an image. The dark black appears in the T1 images by the air, bones, stones, even fast flowing blood, while dark grey appears a collagenous tissue like ligament, tendon, etc., while water containing tissues like kidney, gonads, edema, urine, etc. appears dark grey. Even liver, pancreas, adrenal, muscles may also appear dark grey. While proteinaceous tissues, especially having some abnormal things like abscess, some cyst, having light grey. A bright white appears in the T1 image by fat, fatty bone marrow, blood product, slow flowing blood, contrast agent, etc. Let's talk about the T2. In T2, the air appears black, same as T1, and cortical bone stone appears black, while dark grey by the collagenous tissue like ligament, tendon, scar, etc. High bound water tissues also appear dark grey to light grey like liver, pancreas, adrenal, hyaline cartilage, muscles, etc. While the fat or fatty bone marrow appears from intermediate to bright white in a T2 images, while high water containing tissue appear bright white like kidney, gonads, edema, fluid, urine, bile, etc. The proteinaceous tissue blood products may also appear bright white in T2. So, after discussing the T1 and T2 images, we will discuss about the imaging hardware. So, the MRI is having some important hardware like magnet. So, this magnet create a strong and stable magnetic field, typically 1.5 Tesla to 3 Tesla in clinical use of MRI. Another important thing is gantry or the scanner. So, gantry is a structure from where the animal may get entered inside of the machine. So, another is a important structure is gradient coil. This gradient coil is very important because this gradient coil create a varying magnetic field for spatial encoding. Apart from this gradient coil, the radio frequency coils are also present in the machine. It acts as a antenna to transmit the radio frequency pulse and it receives the emitted signals. Another structure is quadrant detector, which is present in the machine and detect the radio frequency pulse wave. Patient table, this table is having a movable property. It is moved inside of this machine along with the patient. It goes upward direction, it goes downward direction like that. So, this is a movable patient table. So, in veterinary field, the patient table may changed according to the size of animal and the size of gantry. And another important component of this hardware is set of the computer. It processes the raw data and construct the detailed images. So, this picture is showing a whole MRI machine having a radio frequency coil, gradient coil, gantry, strong magnet, patient table, etc. Now, this is a cross section of the MRI machines. So, this MRI machine is having clearly you can appreciate the magnet, strong magnet. The major portion of the machine is made up by the strong magnet, gradient coils, radio frequency coils, scanners, and patient table, and patient you can lie in between the machine or inside of the machine. So, after the machine component of machine, we will discuss about the contrast agent, how to enhance the visibility of organ or enhance the contrast of any organ. So, you can give a simple water to the patient orally, so that it also act as a contrast agent for magnetic resonance imaging, especially for the stomach and the small intestines. Although certain substances with a specific magnetic property are used for various type of soft tissue imaging, that is called as paramagnetic contrast agent. The paramagnetic contrast agent is used to increase the enhance the contrast of a soft tissue by using the gadolinium compounds. So, these gadolinium can enhance the tissues and fluid, appears extremely bright in T1 weighted images as compared to T2 weighted images. So, these provide highly sensitivity for detection of the vascular tissue, especially the cancerous mass or the tumorous mass, which permit the assessment of the stage of the tumor as well as the cancer. These contrast agents may also allow to assess the brain by the brain perfusion, especially in the case of brain stroke. The strong magnetic field is necessitate the rigorous safety procedure because of the ferromagnetic object like wrenches, oxygen tanks, floor polisher, etc., and can become lethal projectile in vicinity of the strong magnetic field, so that all the magnetic objects should keep away from the MRI room. So, these are the certain contrast agent which can use during MRI imaging. So, gadolinium EDTA generally used for central nervous system. Gadolinium DTPA is used especially for the central nervous system. Gadolinium DOTA used again for the central nervous system. Ferric ammonium citrate, this contrast agent is used for imaging of stomach as well as upper intestine, small intestine. Mega-40-par trisodium is a contrast agent used to detect a lesion of a liver. Gadodiamide is another contrast agent used in the central nervous system. So, before entering in a magnetic resonance imaging room, always you should follow some certain safety protocol. The first and important safety protocol is always you have to avoid to take a ferromagnetic items inside of the MRI room. The pregnant animals should avoid to place in a strong magnetic field. Always try to use 2 Tesla power MRI machine for imaging of veterinary patient. Pacemaker patient should also be avoided for MRI imaging, and the power of the radio frequency wave should not be increased from the 0.4 watt per kg of body weight. So these are the certain safety protocol you have to follow during magnetic resonance imaging. So how to prepare the animal for MRI? So MRI, basically the MRI uses strong magnetic field, so you can pull any ferromagnetic metal object like prosthetic hip, intrauterine devices, artificial heart valve, pacemakers, etc. So you should avoid these type of patient inside of the magnetic resonance imaging room. Surgical plates, pin, staple and the screw poses no risk during MRI, but one condition is there: the surgery was performed more than 4 to 6 weeks before. So dye, tattoos, permanent eyeliner, certain metallic iron oxide could also heat up during MRI procedure. So basically these things are showing interest for human being. In animals, there is very little chance the animal is having dyes or tattoos, permanent eyeliner, etc. Okay, but if any animal is having these type of things, you have to avoid MRI in those cases. The magnetic field will not affect tooth filling, but distort the facial image area or the brain scanning, so that you have to ask the owner before going to MRI about the tooth filling. Hairpins, jewelry, hearing aids, glasses and other dental work should also be avoided in the room. So you have, if owner is wearing all the things, you have to remove all the things from the owner also. In animals, you have to remove the belts, neck belts, etc. Pregnant animals should be avoided in the room, and animals should be sedated or given the anesthesia because of the close confinement and claustrophobic region. How to prepare the animal? So pre-procedure preparation is, so before preparation you should go for complete clinical evaluation, so that according to that you have to choose the anesthetic protocol, go for complete blood test, etc. Anesthesia is mandatory for MRI procedure in the animal because it is essential for the immobility of the animal, and continuous monitoring of heart rate, respiration rate and temperature is also mandatory during the MRI procedure. The positioning of the patient, so according to the area of the interest, you have to position the animal. For that you have to place the animal in accurate anatomical positioning, so that the critical quality images you will get. The imaging scan duration is 30 minutes to 90 minutes is minimum for single scan, so that you should make a mind and give the anesthesia according to the duration. So, if you want, you can go for multiple sequence or multiple imaging techniques like T1, T2, FLAIR, STEER, etc. So, the time may get increased. So, this is a protocol for preparation of animal for MRI imaging. Let's discuss about the application of MRI in veterinary patients. So, with the help of MRI, we can diagnose the neurological, musculoskeletal, cardiovascular disorders, herniated disc, arthritis, small tears and injury to the ligament, tendon, muscles can be diagnosed in a very early stages. So, MRI of the cardiac or heart may give a detailed blood vessels images without contrast material. Supermagnetic contrast agent iron oxide nanoparticle can also be used for imaging of the blood vessels. You can also use the magnetic resonance imaging for the ophthalmological purpose to diagnose the etiology of blindness, pupil size changes, bulging of eye, retina, lens, cornea, etc. You can also use the MRI to scan the liver, kidney, spleen and adrenal problems. Another application also included like sneezing, gagging, head shaking, flinching, various neurological sign. All the application is always based on the veterinarian recommendation. Let's talk about certain musculoskeletal diseases which we can diagnose with the help of magnetic resonance imaging, like subchondral bone lesions we can diagnose with the MRI, articular cartilage problem, ligamentous and the tendon injury we can diagnose it, muscular trauma we can diagnose in the dogs. In equine we can diagnose the navicular bone diseases, any type of hoop abnormalities, any type of bursa problem, navicular bursa problem or disorders we can diagnose with the help of this MRI. Laminitis, this is another very common problem of the horses. The hoof may get affected. You can diagnose with the help of the intensity of the laminitis. The tumor evaluation, detection of the foreign body, etc. Again, we have to diagnose with the help of MRI. Other conditions like seizure, chronic cervical pain, upper versus lower motor neuron diseases, lumbosacral instability, trauma, stroke or the thromboembolism, pituitary based tumor, ocular or the orbital diseases, head and the nasal neoplasia, neoplasia of the soft tissue may also can diagnose with the help of MRI. So, risk regarding this MRI, the radio frequency energy may get excite the molecule in similar to those from a radio or the TV station. The caution must be taken in a patient with a metal implants and the pacemaker. In veterinary field, it requires a general anesthesia to ensure the clearest and the most accurate image possible. So, these are the certain risks during MRI imaging. Let's conclude the today's topic. MRI is a powerful diagnostic tool. We can diagnose various conditions affecting to the animal. It is essential for detailed soft tissue evaluation. for research purpose also, for teaching purpose also. It is safe, but it is having expensive and it require anesthesia. Now the MRI is having a growing importance in veterinary practice. So this is all about the magnetic resonance imaging. Thank you.